Hello. In this section, I'll be demonstrating the correct way to use your Forteo delivery device. Before we go over injection technique, here are some important points to remember about your Forteo medicine. The Forteo delivery device contains 28 days of medicine. Throw away the Forteo delivery device after 28 days, even if it is not completely empty. Do not use the Forteo delivery device after the expiration date, printed on the carton and delivery device label. Do not inject more than one dose of Forteo in the same day. Do not transfer Forteo to a syringe. This may result in you taking the wrong dose of medicine. Do not share your Forteo delivery device or needles with anyone. Please remember that this video is a demonstration and is not intended to take the place of the Forteo user manual. Rather, it is intended to help illustrate the information found in the user manual. The Forteo delivery device contains a 28-day supply of Forteo in prescribed 20 microgram daily doses. Forteo is also known as teriparatide, rDNA origin injection. Before I demonstrate the injection technique, I will point out the different parts of your delivery device. This is the white cap. This is the medicine cartridge that contains your Forteo medicine. This is the label that identifies the Forteo delivery device and contains important information such as the expiration date of the medicine. This is the blue body of the delivery device. It has been designed to be easy to hold while you perform your injection. This is the black injection button. This is the yellow shaft that appears when you pull out the black injection button. This red stripe will appear when you pull out the black injection button correctly. The needle used with this delivery device is contained within a large needle cover and sealed with a paper tab. This is the large needle cover. This is the paper tab that is attached to the large needle cover. This is the small needle protector that covers the needle. This is the needle. For a more detailed explanation of the individual parts of the Forteo delivery device, be sure to refer to the user manual. Take the Forteo delivery device from the refrigerator. Put the Forteo delivery device and your needles on the surface you will be using. Before preparing the Forteo delivery device for use, be sure to wash your hands and prepare the injection site as directed by your healthcare professional. Pull off the white cap. As a number of medicines are available in pen delivery devices, always check the label on your delivery device before each use to make sure you have the right medicine and that it has not expired. Do not use if the Forteo delivery device looks damaged, if the medicine in the cartridge is not clear and colorless, or if it has particles in it. Your Forteo delivery device is now ready for its needle. Always use a new needle for each injection. Pull off the paper tab from the large needle cover and throw the paper tab away. Attach the capped needle to the end of the Forteo delivery device by pushing it straight on. Then, screw on the needle in a clockwise direction until it is firmly attached. Make sure that you don't over-tighten the needle, since you will be removing it after the injection. Now, pull off the large needle cover and save it. Be sure to keep the large needle cover handy because you will need it to remove the needle after the injection is finished. To set your dose, pull out the black injection button until it stops. If you cannot pull out the black injection button, please see the troubleshooting section, Problem E, in your Forteo user manual. Check to make sure you see a red stripe. Pull off the small needle protector and throw it away. Remember that you want to inject Forteo into the subcutaneous tissue, which is located just below the surface of the skin. Feel free to ask your healthcare professional for more instructions about injection technique and rotating the injection site. You can inject into your thigh or abdomen. Today, I will demonstrate an injection into my abdomen. Gently hold a fold of skin and insert the needle straight into your skin. Push in the black injection button until it stops. Hold it in and count to 5 slowly. 1, 2, 3, 4, 5. You must wait until the count of 5 to make sure you receive the correct dose. When you have finished counting, remove the needle from your skin. After you've completed the injection and removed the needle from your skin, take your thumb off the black injection button. Check to make sure the black injection button is all the way in. If the yellow shaft does not show, you have finished the injection steps the right way. You should not see any of the yellow shaft. If you do, and have already injected the medicine, do not inject yourself a second time on the same day. Instead, you must reset the Forteo delivery device. See the troubleshooting section, Problem A, on the back page of your Forteo user manual. Put the large needle cover that you had set aside back onto the needle. Do not try to put the needle cover back on with your hands. One way to put the cover back on is like this. Unscrew the covered needle all the way by giving the large needle cover 3 to 5 complete turns in a counterclockwise direction. Pull off the needle and throw it away in a puncture-resistant container as directed by your healthcare professional. Push the white cap back on your Forteo delivery device. Right after use, put the delivery device back into the refrigerator. Read and follow the instructions in the user manual and the medication guide section entitled, How Should I Store Forteo? Do not store the Forteo delivery device with a needle attached. Doing this may cause air bubbles to form in the medicine cartridge. Do not freeze Forteo. If the Forteo delivery device has been frozen, throw the device away and use a new Forteo delivery device. If the Forteo delivery device has been left out of the refrigerator, do not throw the delivery device away. Place the delivery device back in the refrigerator and call Eli Lilly and Company at
02-2715-2950, 02-2715-2950.
Before throwing away the Forteo delivery device, be sure to remove the needle. Throw away your Forteo delivery device and used needles as instructed by your healthcare provider, local or state laws, or institutional policies. Congratulations on successfully using your Forteo delivery device.